Welcome, y'all. How's everybody doing? Good to see y'all. I see a lot of friends out there. I am filling in today. So this panel was originally constructed to be a look at peers in non-traditional peer settings. We work for Health Brigade, which is a free clinic in Richmond, Virginia, and we do comprehensive harm reduction or needle exchange out in the community. We're a community-facing program. We go out on a van 4 days a week to provide needle exchange, Narcan. I'm going to let the panelists talk a little bit more about it, but these are my colleagues. These are people that I look up to. In full disclosure, the person that was supposed to lead this panel was Tiffany Wells. She's a friend of the program and a peer. I'm not a peer. I'm a social worker. So I'm just filling in for Tiffany today. The questions that I'm going to ask these folks were largely designed by my colleague and the other coordinator of this program, Zico Singleton. Unfortunately, she can't be here today, but fortunately, she is speaking in front of the CDC today to talk about the importance of harm reduction. So huge shout out for her. She's missing this, but she's up in DC fighting the good fight. So yeah. So I am just going to ask them some questions about their work and how they perform their work within the comprehensive harm reduction setting, and we can talk a little bit more about harm reduction if people aren't as familiar with it, and we'll have some time for some questions at the end. Does that sound good? Y'all ready? All right, Dia, I'm going to start with you, buddy.
Perfect.
Okay. Dia, as one of the only 2 women on our team, how has your perspective as a woman influenced your leadership approach in harm reduction spaces, especially in environments that may not always be gender inclusive?
So this was a think piece for me, right? Because I feel like Zico and I have a unique experience because we are part of a team with emotionally intelligent males, right? So we don't face some of the stigma and some of the non-inclusivity that usually goes on in spaces like this. However, my experience as a woman on this team has been the fact that I can be a little more nurturing to our clients. I can offer those hugs freely and it not be looked at as weird or intrusive. I can offer that kind of mothering that they need sometimes, where coming from Joe, it might not be received as openly, especially by the guys on our program, right? So that's been helpful. I know that also sometimes the things that women go through in addiction, and especially active addiction, and the things that they have to do to survive, can foster guilt and shame inside of them. And to have somebody on a team that has been there and knows what they're going through and they can be open about those traumas with, can be like very healing for them. So that's my experience.
Yeah, thanks for that. I wonder if, because I think a lot of time in care spaces, we as a society put a lot more of the burden on women. And I think sometimes that can take its toll over time. So I'm just wondering how you deal with that, how you kind of lean into that or fight back against that, and also like take care of yourself throughout that. Because I think, and I see as somebody who observes this program all the time, a lot of times some of that burden falls on you because of the way you show up and because of your identity.
So for me, it's the first thing I learned when I got into recovery for myself is boundary setting, right? I can be that nurturer and I can be that compassionate caregiver and still have boundaries and still set up those parameters where, like, I love you, but you can't cross this line. And you have to learn that that's okay. it's okay to have those boundaries, and it's okay not to be able to do that for that day. If I come in and I tell them, like, my tank is at 30%, like, that's what I can give today. They have a way, my team has a way of picking up that other 70%, like, seamlessly. And I have to learn inside myself to be okay with that, and to know when I need a break, and to know when I need to say, I need y'all to help me pick this up. And I've learned that. And I take my PTO. My co-coordinators have said, take your PTO. Don't work when you take your PTO. And I had to learn that too. So self-care.
Thank you so much, Dia. All right, I'm gonna turn to you, Art. Y'all, again, this is Artware. Art is a peer and somebody. Besides myself, he's been the longest member of the CHR team. He's been with Health Brigade for 4 years, 5 years? 5 years. And he's someone who's lived in Richmond his entire life. So this is somebody that really shows up for his community, but also when we go out to do outreach, do street outreach, I think probably more than most of the people on the team, he knows these folks. He grew up with them. He went to high school with them. And we also know that middle-aged black men and middle-aged to later-aged black men are the folks that are most impacted by overdose. We've seen a big rise. So it's really important that Art is able to show up as our overdose prevention specialist. So my question for you, Art, is how does your role as a more mature peer on staff influence the ways you build rapport and foster trust with participants, especially older black individuals? And can you share an example where that shared life experience directly impacted somebody's engagement in the program?
First of all, I'm glad to be here and working in the capacity I am. I felt like I was groomed for this position because of the fact that I failed quite a few times at recovery, but I kept getting up and want to demonstrate that recovery does work and it is possible. That's what I like to be an example for most of the people that come to our table. Also, I'm engaged in saving people a Narcan and bring people back. An overdose specialist also is part of my title. I also have had people that I have went to school with, and we were introduced. I was just reflecting and talking to this black guy that I went to school with, how we got introduced to substance abuse in the first place. It came to us as a way to make money, because we had looked up at a lot of the people, generations before us, had all these nice things, and it was supposed to have been a way where we could achieve some of those same things, right? So I had to interact with one particular black guy that has been coming to the table, and he wanted to know what I had done to get to the point where I am. And I shared with him the pathways to different recovery, and some of those things I had tried myself numerous of times. But what worked most for me is going over the journey that I had been and the experience that he and I both could relate to. And since that time, I haven't seen him, I talked to him, but he has made an effort to stay clean and stay out of the environment. So I get rewards from that as well, because I know this does work, you know, and every pathway may not work for everybody, but I tried just about all of them, you know, and the one that I was more determined was to self-management. And I did that without having any assistance as far as medical assistance. I just felt that I had to do it and endure whatever pain came along with it. because I had also experienced so many pain and suffering going through the role of addiction. And so when people come to the table, I'm always trying to give them warm support. I also think about things that I can do to encourage them. And my role as a peer has given me different ways to address as far as with the language that I use, because I always felt stigmatized and ashamed to ask for help. So people come to us now, we're a non-judgmental program. We don't hear that story, we just give them what they need, and we have our ear available to them if they need to talk, set time aside. We can't devote a whole lot of time to them because of the fact that sometimes out on our outreach environment, a lot of people need help and service, and we kind of keep the line moving so we can get to everybody. So it's been a rewarding situation, and also being in this capacity keeps me grounded and enforce my level of concern and focus on staying clean. And I want to be a beacon for people that come up there and see, no matter what age you are, you can recover. And that's my strength to me. Thanks for letting me share.
So I just have a follow-up question because, over the last 5 years, I've just been able to, interact with you and see you grow, see you go through the peer training. Like you said, shift in language, shift in perspective. As we do this work, we continue to grow and change. And, it's been a joy to see, but I'm also wondering, like, as we do this, as we continue this work, and, we've seen a steep decline in overdose over the last few years with, more Narcan getting out there, but we're seeing in our program an increase over the last few months with a volatile drug supply. There's been a lot of overdose spike alerts here in Richmond and across the state. I just wonder how that has impacted you. I know that there's some days that are just like really, really heavy, especially knowing that the war on drugs is most violently impacted your peers. So I just wondered if you could speak to that a little bit.
It takes a toll on me a lot of times because a lot of people do come to the table. I've known them a while and have had some experience with them as far as using, and people don't show up, and you're accustomed to them coming regular, and you wonder what happens to them. And sometimes it be overdose or some other situation where the drugs have had that negative impact on their bodies, even though they might not overdose precisely, but has other ramifications as far as health. And so it does, and I don't take a lot of time off, but sometimes it gets to the point where I need a break. But I'm still glad that we are making a difference. And also, a lot of times, when I get off from work, I go to the community where I'm still experiencing situations. People ask me things about, do we feel like we are helping or making it worse? And I have to express to them that people are gonna do what they're gonna do. We just try to make it safe for them to do it, and also make it safe for the community, because some having needles, safe needles, that don't get back to the community with some infections because they're able to use clean supplies. Also, we cater to the community as well. If it's some things they need, we have available Narcan, masks, hand sanitizer. We also give out snacks for people because they may not have eaten, or that's the only thing they might get to eat today. So I get a lot of gratification from being able to do that as well. But it does take to have a toll sometimes, seeing the people that you know and maybe have grown up with surmise and go through that situation. And I also feel helpful that I can give demonstrations about how to use Narcan and to give them certain information about how to keep it available, how to let people know where it is, because with the advent of fentanyl, you can't help yourself. Like back in the past when people were OD, you could walk them, put cold suppressants on them, and different things where fentanyl affects your brain and cuts off your breathing. You don't have no chance in it in about 20 seconds. So I get satisfaction of knowing that I can arm these people with things that can help themselves and put people in position to know where they're located. And we also go out on outreach, target outreach, where we give out Narcan and we give out information, and we came up with signs that they can put in their windows of establishments where people will know that Narcan's available. Because we've had people bring people to us on the site that had OD, and we revised them, you know, because they didn't want the police involved. So we are in the community, and people know we are there, and they come for whatever things they may need that we have offered off the truck. You know, only thing we ask, you don't come in drugs or bring weapons to the table or cause disruptions where we can't deal with other people that need our services.
Thanks for sharing, Art. We were out at outreach one day, and Art jumped on a bike to go bring somebody back with some Narcan. It was a sight to see. All right, Joe. I think part of what is so beautiful about this panel is that you know, we talk about you know, peerhood or peership in this kind of broad stroke, but I think everybody comes with their own personal lived experience, and their own experience kind of guides how they approach the work, you know, who they can connect to and whatever. So, Joe, you've had your own kind of experience with some wounds that have been difficult to treat over time. I'd like you to talk a little bit more about xylazine and what we're seeing as far as like outreach when we go out in the community, these larger wounds that we're starting to see here in Richmond. And the question that Zico had come up for you is, can you describe a moment during your own wound care treatment, maybe a time when a particular supply or approach made you feel unseen or overlooked, and explain how that experience influenced exactly which dressings, cleansers, or educational materials for wound care you now include in the wound care kits that we distribute?
Let me throw a little background on that. So the wound that I got, I had a few wounds because it happens, you know, infections will happen. I got to a point where I couldn't stand for more than like 15 minutes because my leg would swell up and the pain would be too intense. And I had a big, like, open wound on my leg. It stopped the blood from flowing, and I was scared to go to a doctor. I didn't want to go to a doctor. I was ashamed to go to a doctor. And that comes from, you know, they're going to treat you differently when they find out, you know, how you got it, you know, all that information. And they're like, okay, well, you sit over there. We got other people to take care of. Because they don't take you seriously. That's your fault that you did that to yourself. So I got people that are, you know, they sustained injuries that they didn't do themselves. You know, you're doing that. At one point, I was living in New Orleans. They basically wanted to amputate my leg from the knee down. That was their solution to this problem. I came to Richmond where it got fixed in one day. Well, not the whole thing, but the pain, they were like, well, here's what you need to do. We're gonna send you to the surgeon. They're gonna clean out all the veins in your leg. I started a job the next day. Like that's being seen. I was not being seen. I was being treated differently in New Orleans than I was here. I think this happens to a lot of people. I think that's why people don't want to go to the doctor. And what we're seeing out there is a lot of xylazine wounds. Is there anyone here that doesn't know what xylazine is? All right, so it's not a lot, and that's good. So xylazine is It's basically an animal tranquilizer, generally used on larger animals. It will cause these kind of wounds. It does other things as well. It's a tranquilizer. But the one thing that is noticeable to us that we've had to develop a wound care kit for is because it causes it'll start off as like a pimple. And it can show up anywhere on your body. It doesn't have to show up where you're shooting it. I had a next door neighbor that got it in his eye. I had a friend who thought swallowing xylazine or just swallowing their drugs in case it had xylazine in it, putting in capsules and swallowing it would be a good idea, but then she got a wound here and she passed away because of it. It eats away at your body. It gets into the muscle, eats that away, and if it gets down to the bone, amputation has to happen because there's nothing else you can do. The pain, I can't even imagine because I know the pain on my leg was unbearable. Not being able to stand for more than 15 minutes means you can't work, you can't walk around. You're basically screwed. I see people walk up to our table with wounds on their legs and they're having the hardest time walking, but they're gonna make it there, And we got someone like Ernest here who can take care of those wounds as best that we can. I encourage people to get out there and go to a doctor, a wound care doctor. I'd say 95% of them won't do it because, much like I was, you can't take it seriously because you got other things to do. You can't take the time to go see a doctor. You can't take the time to go see a doctor who's just going to talk down to you. You have enough of that. You already have guilt. You have shame. You don't need someone else to do it for you. So we developed these wound care kits. Colin and Zico had a doctor come in and, give them, the best ideas of what we should have. I had my input because on a daily basis, I'm still taking care of my leg. It's been 15 plus years and I still have this wound. It's healing. It's looking good, really good. But that wouldn't be possible if I didn't come to a city where the doctor looked at me and said, we see that and we're going to take care of that. And that's what they do. So it makes a difference. And I try to tell people out there, you live in a city where people are going to take care of you. You can go get this done. And a lot of our people have Medicaid. That's a whole different thing. This Medicaid thing is too much. But that's what these people, they depend on that. And it's still hard for them to go see a doctor. The wound care kits are pretty cool because, man, I can't even imagine if we had something like that when I was out there. It doesn't stop, it doesn't cure the problem. But I think it stops it from getting worse. A lot of these people, they don't have any place to live. They're living outdoors. And to have an infection on your leg when you're living outdoors is just a nightmare. They can't take care of it. It's open to everything out there. So just to be able to have it wrapped is good. Now we can't provide enough for them to wrap it every day for a week. We just financially can't do that. But we can have them wrap it, for the time. And we have a zero form that kind of sets inside the wound that can pull some of that infection out. We have pads that they can soak the blood and everything else that comes out of that wound, which is a lot. So a lot of this stuff that we do, it's important, but I wish there was a way that we could get them to go see a doctor because there's only so much we can do. Ernest here, he sees them, he wraps them, he's got that down. So it's just a rough one. And the xylazine is just, the xylazine thing really bothers me because everyone talks about fentanyl. No one really realizes that fentanyl, yeah, don't get me wrong, it's a problem, but most people out there are just doing fentanyl now. There's really, heroin's just that's gone. You know, it's really hard to find that nowadays. And the xylazine, no one talks about it. Government doesn't talk about it. State governments probably never heard of it. Or they have, and I just kind of get the feeling they have, they just don't care. They don't see it as a thing. And it's one of my problems with this whole Medicaid thing getting shut down is we're gonna have people walking around with a lot of open wounds, a lot of infections, and it's like people don't understand that, and until we start talking about xylazine more, no one's gonna care, and they're not gonna see it till it's too late.
Thanks for sharing, Joe. I think some of the things you said reminded me of a few things. I think there's things within harm reduction and this work and substance use work is like, there's some things that will just remain the same as like interacting with people with lived experience when you're going through some of the same stuff is always going to be a validating and practical and effective manner to do things. But in harm reduction, you know, there's a woman named Louise Vincent. She's the head of the North Carolina Survivors Union in North Carolina. And she said, if we're doing harm reduction like we did 20 years ago, then we're not doing it right. We're always having to change strategies. This xylazine thing has become probably the biggest part of our program, addressing wounds. Joe has been a huge part of that, and also being able to identify and also give advice to folks that are experiencing some of these bigger open wounds with very little resources and not willing to go into these unsafe medical settings where they've been stigmatized repeatedly to the point where they would rather live with open wounds than go see a doctor. So appreciate your work, dude. All right, Ernest. So this is Ernest, y'all. He's our team phlebotomist. He's the newest member of our team. He's been working at Health Brigade. I'm not gonna tell your whole story. I'm gonna let you tell it. But he's been working at Health Brigade for about 7 years, and has recently come to Health Outreach. So we're able to bring some of his medical expertise out to the field. So we often call him Vampire, and he rides around in a van that he calls Vanpire. So this is Ego's question for you. You ready?
I think I am. Good morning, everybody. How y'all feeling out there? I'm a little nervous as well, too, so if my heart is like pounding and it sounds like it, it's because it is. It's a lot of people looking at me at one time, so
You'll be fine.
I just wanted to preface the conversation with that. Go ahead,
You'll be
Colin.
fine.
I'm nervous too. How has the addition of you being hired as a full-time phlebotomist on the team change accessibility, speed, comfort level of HIV and hepatitis C testing for people who use drugs? And can you share a specific example of how this has influenced someone's decision to get tested? And if I can just add to that, if you can talk about the testing piece, but also maybe piggybacking off of what Joe was talking about, talk about some of the wound care stuff and your knowledge in wound care and wrapping people's wounds.
Thank you, Colin, for that loaded question. All right, so it's a couple of different things that he broke into that conversational question that I want to break out first and foremost. What does the addition of being a full-time phlebotomist mean to the team? Number one, accessibility to have somebody in healthcare out in the street has made a difference to our program. CHR, I feel like, was just needles and Narcan. And our new slogan is, we're more than just needles and Narcan. You know, we have wound care out there, we have testing out there, and especially when it comes to substance abuse use, most people do not have the concept or the thinking at that moment that, oh, HIV is out there, Hep C is out there. It's not something that's in the forefront. My thing is about, I want to get the high, the fix, whatever I need at that moment, but not thinking about what also could happen in those particular moments. And it's amazing to be able to step into a space to have that opportunity and privilege to test somebody and to also reduce harm in that particular way outside of substance abuse use. I think it's something different to be able to say, well, hey, what are your risk factors? Are your rigs clean? You know, I had to learn a whole lot of new language when I started this position because I was only speaking medical at one time. I've actually had to talk regular and be like, well, hold on, what is this with someone on? What's happening here? And really gauging out those risk factors has been a privilege for me. So, and especially when it comes to testing, having that open conversation with somebody, because our community, we have sex workers out there. We have people who are working in unique spaces as well, too. So having that open conversation, especially if you're in the sex work practices, you know, drugs and things and alcohol and that goes along with it. So now I have to have that conversation about, so what are you using? And then also too, are you using in the most safe possible way? That means, you know, condoms, and then also realizing if you're using in your party experience, how everything is going on, that kind of situation. So it opened up a new level within that part, especially when it comes to being comfortable with Hep C and HIV. Is that a comfortability? I don't want that to be comfortable for anybody in this particular day and age, especially in 2025. But the great part about it is we have the opportunity to stop it right then and there. And when you talked about the speed and accessibility, I can test you right then and there, and then I can also link you to treatment right then and there. That's the great part about it. You don't have to float out into the world and just know your status, and there's nothing that's going to happen about it. It's hard, especially in this new administration, when Ryan White and things like that have been stripped from us, that accessibility to being able to know your status and get help from it. You know, Health Brigade has been at the forefront for over 50 years of really showing up for the HIV community, and we appreciate that. And I think it's different also, too, to sit on both sides of the table, somebody who tests and somebody who lives with a lived experience, that I can show up in that space and say, hey, it's going to be all right. And also within your substance abuse use, you don't have to do it so hard or feel that particular way because you probably were using because you found out about your status, and then that makes you feel a certain type of way. And then erasing stigma like that. I show up as the niche market every day, and I appreciate that. I'm Black, I'm gay, I'm in that 30 to 40-year-old range that people are getting ready to go out and do unique things. But to see somebody that actually has the lived experience is still doing well gives them hope in that particular portion as well, too. You also asked me about how does that influence somebody's decision to get tested. Well, if you see like-minded people in that situation, or you talked about your lived experiences, it makes it comfortable, it makes it easier, it makes it more of a fluid experience to really say, hey, while we're talking about your risk factors, let's talk about getting tested as well, too. Do you know your status? You know, you equals you, and especially when you're in spaces where people relatively haven't even talked about their status, or it's not a thing that comes up in conversation. That's another great part about it as well, too. But it definitely, I have a situation that was my first experience out in the Churchill area. A man came, he was using in a group experience, but realized the people in his group were starting to change, and he wanted to figure out what was going on. And he was like, so I see you're doing testing over here. Well, what are you testing for? And I'm like, well, I do testing for Hep C and HIV, and, you know, I do wound care as well, too. And he was like, well, darn, I've never been tested in a while. Or, you think you can test me right quick? And the great thing about my vampire, it's a bat cave, it's a layer, it's confidential. I shut the door, you're not gonna see anything that happens in there, and we can have that private talking moment. But from that test, he was able to bring 3 other people to get tested as well, too, because he felt so concerned about his group population that he wanted them to get tested as well, too. The great part is most people may or may not know that 1 in 4 people can be tested, and out of that 1 in 4 people, if you count around the room, somebody's living with Hep C. That stigma has to be erased, that number has to be erased, and we can have point of care testing like we do out in the field. It makes a difference in those numbers. Thank you.
Thank you so much, Ernest. I just wanted to speak and rename something that Ernest said, is that Ryan White, which is HIV care, across the state, across the country, in Richmond has essentially been defunded. There is no HIV care in Richmond anymore. We have a program at Health Brigade. It's one of the last standing. We have people that are running that program. We have no dollars to provide care for people. So I just want that to let that sink in for a minute about what that means for the people in our community, the people that we love. And I know that this is kind of happening across sectors, but we're going to see in the current conditions, we test a lot of people that test positive for hepatitis C, not so much HIV in our program. We do have cases, but it's not as prevalent as hepatitis C. We're going to see a large rise in that with people not being in care, not being able to get their medications, not having any resources to get housing and jobs, support groups, that kind of thing. So that's going to be to programs like us without extra funding to actually extend that care to those folks that are being cut off from that support. How are we doing on time? I have no clue what we got. 5 minutes? 5 minutes before questions? Real quick, this is all of our staff here. We're paid staff, but I wanna shout out some people in the audience that support our program that are also peers. Jeff, would you stand up, raise your hand? This is one of our Health Brigade's a volunteer-run organization. We have paid staff, but we're moving into a time where we're going to rely on volunteers more and more. Jeff comes out week after week as a peer to support. Lauren, will you please stand up? Lauren comes week after week to come to a Khalid. Stand up, my dude. So I just wanted to shout them out. I see some other friends of the program in the audience, people that come out. Rondell, you come out and give our folks haircuts. Thank you so much. I see some folks from Caritas. Liz, thank you so much for coming out and feeding folks. So this really is a group effort. I think we're going to have to get more and more creative with how we provide service. We have no clue what our funding looks like coming up. So that's going to be my question to the entire panel before we go let the audience ask questions. Is in this moment that we're in, where we're seeing HIV cut, where we're seeing ICE kidnap people, where we're seeing universities not give diplomas to students for just talking out against genocide, and the extreme cut in funding, what does that mean for a program like ours, and how are we going to survive?
So we were just talking about this the other day, and my analogy of that is, sadly, it's like we're living the Hunger Games as far as funding. And it makes me sad because all of the recovery community is usually super cohesive and cooperative and a community. And when that turns into competition, we're headed in the wrong direction. So for me, what that looks like is continuing to show up and do the work and be there and continue not only to show up for my team, but Jan's team and Caritas's team and everybody else's team that might need me. Because without all those layers and all those people and all those everything, we can't save lives, and we can't keep people alive until they want to do something different inside of recovery, right? So we also have to realize that we're not going to be able to win this fight sitting in our air-conditioned offices behind our desks. It's not going to happen that way. We have to get out into the community. We have to get out into the streets. We have to get out into the rallies and fight for what we believe in and fight for what our community needs. This is not going to be easy, and it's not going to be short-lived, and it's not going to be something that we can just bounce back from. That's not going to happen, and we have to be realistic about that, and we have to be truthful with ourselves and everybody else about that. And you're either with us or you're not. And if you're not with us, then get out of our way and let us do our work.
As he said, I am a paid staff member, but I am willing to sacrifice and volunteer and help because I know it's essential that we do what we have to do to safeguard our community as well and the people, the participants that we serve. I don't like to get political, but I still think we need to get people out of the field that supposed to be representing us and doesn't do a good job of representing us and advocating for the things that our community need. It's easy to say one thing and then do another, but I do have confidence and faith in the people that we work for and the people that supposed to represent us and advocate for us, especially the ones that seem to be sincere.
I have a lot to say about this. Most of it's negative, so I'll try not to be too negative. I'm angry at the people who don't care. I'm angry at the people that think this isn't going to affect them. This is going to affect everybody. And again, going back to the xylazine, people are walking around with open wounds. If you think that at some point that isn't going to affect like somebody with a smaller open wound or like, you know, it's going to get nasty out there, you know. And as far as like, you know, basic needs, we do hygiene kits that are so helpful to people. We get a lot of that donated, and that's a good thing. So things like that, they're really important, and I really wish that this wasn't happening. And I know it starts with the federal government financially, and then state, and then city. I think in order to take care of this, we need to start with the city, then the state, and then federal. Like, the people in this city have to start, okay, we need to do something about this. That's where it's gonna start. And also as far as this competing for funds thing, I think at some point we're gonna have to like try to get together and pool funds because we can't have one place just surviving. We need all of us. We need every one of us to be able to keep doing this. I don't know how that would look. I don't know how it could be done, but I just kind of feel like we need to like pool our resources together and try to take care of this.
I'll just add real quickly, I feel like we have the opportunity because we are such a large connected web that everybody should go out and spread the good word. I definitely feel like it's going to take a collaboration effort and being able to not only think about us under one letterhead, but multiple divisions that have to go out there. And then thinking about rural communities as well, too. Sometimes they get left out of the conversation because we're so city and popularized, too. A lot of things hit them harder and don't get affected to them until it's too late as well, too. So you really got to think about where we are. And also think about Corona changed our mindset about the way we operate in general. And I think it's sometimes better to go back to basics and think about the smallest things that we can do that really make the biggest impact, because some people say too many chiefs and not enough Indians. You know, I think that statement's always funny too when we're trying to make things go forward, but everybody has that connectivity point to go out and spread the word about what you're doing and what it means to you as well too. And then talk about your lived experience, open and honest with people. The one thing that you can do is be honest, because trust me, it will be received better than most people would actually think. And then just try to take the stigma away. I mean, we all put our drawers on the same. Come on now. So let's start with that part and then work our way forward, because truly the more that we think that we're different, we really are the same.
One more thing I'd like to say too is we have to remember and keep in mind why we do this work and who we do this work for. And those people are usually voiceless in this society and faceless and nameless. So we have to remember that we're fighting for people that can't fight for themselves. And if you have the ability to do that, you absolutely have the responsibility to do that.
Thank you all so much. I think we're going to take some questions. I did just want to plug that Health Brigade just have been meeting as a staff to kind of talk about what's going on. We're going to start hosting some town halls. I see some folks from Sarah here. I know y'all do a lot of advocacy work for peers and people in substance use issues. So We plan to continue to be public facing about the things we're going through and the people that we serve. So yeah, can we give them a round of applause for just. And we'd love to take some questions. I see one.
We have one right here.
Oh, okay. I see you next.
Good afternoon. I don't have any questions. I just have a statement, man. I salute you guys for harm reduction. I bought into it as soon as I heard about harm reduction in this area. I bought right into it. I'm a person in long-term recovery. Had we had harm reduction during my 25 years of shooting dope and cocaine, I would probably still have some friends around today. So I remember in them shooting galleries, them Smithers, using syringes, that maybe 200 other people have used before, And, we say that, well, I had choices to either use them or wait till I get some brand new one. But when you're a heroin addict and you're dope sick, you don't got no choices. You got to get well right now, and you deal with the consequences later. By the grace of God, I didn't contract HIV, but a lot of my friends did. So it was only by God's grace that I stand before you today and not have contracted HIV. So when I began to work at RBHA, I worked on this program, the HIV prevention program, where I did HIV counseling and testing. That was dear to my heart because that was my way of showing gratitude, for not getting it. But I just want to thank you. And I love you, man. I probably helped that guy there buy a car, a house, or something, right? I was one of his financial backers back in the day, But that's another story, right? I'm not gonna tell his story. But I just wanted to say thank you guys, man. Thank you guys. This has been awesome.
Thank you.
Keep up the good work, bro.
How long you been in the field, dude? How long you been in this profession?
18 years.
18 years.
I'm a recovery specialist.
Thank you, man.
Yes, sir.
Hey, Colin, thank you. Health Brigade, thank you. You talked about how we could collaborate moving forward to come up with some united solutions. I think what happens, though, most of the time is that we get so siloed in our own organizations and just speaking with members of our own organizations. Do you have any tips or suggestions for the room on how we can start cross-collaborating?
I feel like the first thing that we're going to have to remember is not to get isolated. It's going to have to be a mindful practice. It's going to have to be something that you remember and you think about and you actively put into action. Like, you can't just be like, oh, we're going to collaborate and then go back and do nothing. It's going to have to be, you have to come up with an action plan around that. And it's going to have to, everybody's going to have to get on the same page. Like, it's got to be a collaborative effort. Not only do you have to remember, but we have to remember, and they have to remember, and they have to remember. So, and once we get deeper into this cycle, it won't be hard to remember because our people are going to need us more and more, and we're not going to have the resources for them. So we're going to have to get creative, right? We're going to have to reach out to who we know. We're going to have to go into our Rolodex and be like, who can I call to help my people? So.
Hello, everyone. I just wanted to commend the group on your commitment to your, your boots on the ground approach to outreach. I think that's awesome to help stem the crisis of the opioid addiction. And I'm going to safely say that you all are the first step in treatment for those with wound care, pretty much putting a Band-Aid on a serious health concern. So my question is this: what is your process of referring patients who need wound care to a continuum of care?
My process of referral first is to see what they have private insurance, Medicare, Medicaid, and figuring out where that puts them at. Unfortunately, those without insurance are going to have a little bit more of an issue, especially not having a nonprofit clinic like Health Brigade around. So the good part about it is I can be out in the street and doing wound care each time I'm out at one of my facilities, or refer them back out to the clinic to come see Dr. Waller, who's there as well too. If they have Medicaid, then the thing is getting them established in that system and making sure they know what Medicaid does for them, because for the portions when it was around, there were some good benefits about it. You know, the great part about it is there are wound care clinics, especially I hear Joe talk about Henrico doctors all the time, and Retreat in their wound care clinic. So that's our process of referral, especially if they don't have insurance, try to get them into the clinic to be seen by Dr. Waller. Because of course, there's only so much that my degree can do, and that's the unfortunate but fortunate part about it. I can at least do something, and especially teaching them the steps about how to use the wound care kit, and then also making sure that they have understanding that, you know, the saline is for a portion, the white petroleum jelly is for a portion, the styrofoam is for a portion, the gauze and everything and so forth in that kit. But that kit really makes a difference, especially in trying to keep that wound clean until the next time that I'm getting ready to see you again.
And I just want to add to that, that though Ernest may not have a degree or a doctor degree, or he's not an MD, but the reality for a lot of our folks is they're just not going to go to the hospital. They're not going to go to the ER. So what is the peer work that we do is, you know, it's, you know, this kind of like, we talk about different pathways to recovery. You know, we all have our different opinions about that, but like, we teach, you know, in our work, we teach people how to fish, right? And so if Ernest can teach somebody how to care for their wound themselves, if they're never gonna go to the doctor, that's probably the best thing that we can do.
I just want to say that this was the first time that I've come to a group and hear you all talk about wound care. Because I myself at one particular time, I suffered from that. And my addiction would not allow me to go to the hospital. It didn't even allow me family time. So I knew it wasn't going to allow me the time to go into an emergency room or to a hospital and sit there for hours and then be crucified about what's going on with me. And I didn't understand wound care, right? My wound didn't start with, what you said the name of it was?
Xylazine?
Yeah, it started from pressure sores, right? And it started from the inside, and by the time I noticed it had worked its way out. And what I saw was that I just went to the store and I bought like gauzes and stuff, and it just grew and got more infection and more, and it took 8 years for it to heal. And I had to actually go to prison to get that time to heal, because I didn't have time, or what I would say, I was always trying to get one more, right? And then when I did go to the hospital one time before, I ended up leaving in handcuffs, because once my name was drawn into the system, the police came and locked me up. Right, so it was a lot of things that I was like, I'm not going to hospital because I don't know if I got a warrant, right? I don't know if they're going to give me anything. I don't know how long I'm going to be there. And, you know, in my addiction, it didn't give me that opportunity. So I'm just glad that you all, you know, come up with this idea to go out into the community and at least let people know how to take care of a wound if they're not going into the hospital.
And I want to be very clear, too, that I have the unique experience to try to figure out what kind of wound it is, because, you know, is it drug-related? Is this health-related? You know, you were talking about a pressure sore. Am I dealing with something that's a diabetic ulcer, or am I dealing with something that's actually directly related to drug use? And that's the one thing that I have to assess when I'm going out there, especially with xylazine wounds, the way that the ring looks around the wound, and actually trying to figure out, is this necrotic tissue that's going down, or is this something that can actually be saved? And then looking at the tissue to say, okay, well, it needs to be more wet, it needs to be more dry, and things of that nature. So it's a really complicated thing, but I appreciate it because it makes me learn more too.
Everything you just said is every excuse that I hear. And it's not just an excuse, it's a reality. It's what kept me from going to go see a doctor. when I'm out there, I explain to people that I have this, and I wouldn't go to a doctor either. But now I tell them, I'm like, because they're ashamed. They don't want to go see it. They'll tell me straight up. And I'm like, I didn't want to see one either, but you know what? F them. Who cares? Like, done. Like, you got to take care of yourself. Thank you, because that's awesome.
Hey, sorry, my name's Umber. I wanted to say thank you about the whole wound care thing, especially with, I used to be homeless, used to be hard into my own addiction. And I wish I had that because I also disability, have an extensive history of self-harm. And with that, unfortunately, there's an issue acknowledged with hospital systems where they end up treating the wound and they'll just dump the patient on the street, no care whatsoever. And just seeing this model is amazing because it gives an alternative to that, because it's like there's no compassion in that, you know, and you guys end up seeing someone as a whole person and seeing their stories and such, instead of sort of just throwing them through a system that is flawed and that is broken and that is designed to leave people with addictions behind. And I want to say thank you for that.
One more? Just have one.
Well, Colin, I want to thank you because you trained me to do harm reduction almost 3 years ago, because I worked for the Chris Howard Foundation and we came down through House Brigade. And Colin see me like 2 years ago and remember my name because he doesn't forget nobody's name. And right now at the Chris Howard Foundation, we go to 3 locations every week, including holidays, to give out harm reduction in Northern Virginia. Thank you.
Thank you, man. Thank you. Thank y'all. If y'all want to applaud for these folks one more time, appreciate y'all.